Useful health and wellness information in medical rounds. The world is ramping up for the Summer Olympics in Tokyo, and hundreds of American athletes will be on the international stage in the competition of their lives. So here to talk more about the heart of the athlete is Dr. Paul Thompson. He is Chief Emeritus of Cardiology at Hartford Hospital and a specialist in an athlete's heart. Welcome, Doctor.
Thanks, Tara, for having me.
So how is an athlete's heart actually different than a more sedentary person's heart?
So, the heart is just a specialized muscle. So the heart of an athlete is a stronger muscle because it's been exercised a lot. So how the heart changes depends a little bit on the sport. If you're doing sports like weightlifting, in which the heart has to pump blood against a large resistance because your blood pressure goes up when you're lifting weights, the heart tends to thicken. In contrast, an endurance athlete, a marathoner, for example, the walls don't thicken as much, but the heart dilates so that it can squeeze out more blood with each beat. A larger heart squeezes down farther, so more blood with each beat. So the heart of an athlete is just a stronger heart, either thicker or larger, so it can provide blood during exercise.
So what is myocarditis, and how common is that in athletes?
Well, it's a very common question now because of the COVID virus. Myocarditis simply means, myo means muscle, cardio means heart, itis means an inflammation, like laryngitis is inflammation of the larynx. So myocarditis is inflammation of the heart muscle. It usually happens from viral infections, and it can cause the heart to have some arrhythmia. In other words, go into an abnormal beating. We're hearing a lot about myocarditis now because even though myocarditis is usually caused by viral infections, some of the vaccines against COVID can cause myocarditis. But I want to put this in perspective. You really should be much more worried about COVID than you should be about getting myocarditis from the vaccines. Myocarditis in general is very rare, and it's like hen's teeth from the vaccine. It's very, very rare. So it's not a good reason not to get vaccinated. I want to make that point. So myocarditis is simply an inflammation of the heart muscle.
All right. Well, thank you. And thank you for clarifying that, because I know it's been in the news a lot. Thank you, Dr. Thompson. Always a great resource. Happy to have you right here in the Hartford area. Thank you for being with us.
Thank you.
We'll be right back.